Hey, I'm Anna Bryce. You guys know me. I'm doing my presentation for Honors Mentorship. I'm doing some stuff about the emergency room. So my mentorship, I mentor at Northeast Georgia Medical Center and the ER in Area G. So this is where the PAs, the physician's assistants, kind of run the area. This is in triage, when they kind of determine the urgency of each of your issues. Area G is less urgent than the main ER area. And my mentor is a PA, so I'm back there with her. We see less of the things that the ambulance brings in, more of small lacerations and the flu type things. So my essential question was, why do people visit the emergency room for non-emergent issues? I chose this from my experience in the emergency room. So a lot of the time, you'll see an increase of patients during the night hours. So this is a lot of the time I see the patients saying that they do this because no offices are open, so they can't visit their pediatrician or family doctor, so they have to go into the emergency room, even if it's a less urgent issue. So this is what I've seen. I've also seen patients increase during the weekends, which is a lot of the time also due to no offices being open, so they don't have anywhere to go besides the emergency room. So that's where you'll see the kind of less urgent issues, and they're that's why Area G is a lot of the time full during the weekends and the nighttime hours. Also, another issue that I've seen is that patients won't have healthcare providers. So this is why you'll also see patients come in with small issues that may not usually warrant emergency rooms, but they don't have healthcare providers like a family doctor to go to, so they have to go to the ER. They also have not tried to utilize a family doctor in the first place, or they're from a new town, so this is why they don't have one. Another reason that I've seen people come into the emergency room frequently for non-urgent issues are drug-seeking type patients. There's no research on this because you can't specifically prove that they're drug-seeking patients because it's kind of an ethical issue, but if you look at, you can check patients' medical history and you can check their past prescriptions, and we've seen a lot of patients in the ER where they've continuously come in for the same issue or different issues with kind of vague complaints, asking for specific pain medicines, knowing specific quantities. So they know a little bit too much about the pain medicines, and they can't generalize their issues. So a lot of the time my PA will kind of point these people out as people that are kind of seeking drugs rather than coming in for issues that they actually need pain medicine for. So my first source was this source from and it's a study on, is it a matter of urgency? And it's an assessment conducted in Oslo, Norway, to determine the urgency of patients' visits to the emergency room. And through this source, it actually found that only about 2/3 of the walk-in patients seen at the emergency room clinic were assessed by doctors as presenting with non-urgent medical issues that could have waited for medical attention until the next day. But only 1/4 of the patients shared this assessment of their consultation. So this source kind of helped show that a lot of the times patients will go in with issues such as, headaches could be a huge issue, but at the same time, if they come in with smaller headaches, flu-type symptoms, coughing, that type of thing, especially with children, you'll see. And it's just because they have a lower standard of classification of urgency. So what a doctor might see as urgent, such as like a heart attack, for example, a patient might see a headache as that type of urgency, that level of urgency. So they're just classifying emergency room urgency differently. They have a lower standard, and so this is why a lot of the time you'll see patients in the emergency room for reasons that just don't seem as high priority to the doctors and the PAs. Another reason that people go into the emergency room with kind of non-urgent issues that I found was that they have a lack of medical knowledge. So just from things like taking this class, for example, any healthcare class, you kind of have a better understanding of health issues and things that are serious, that warrant emergency room visits. But a lot of people that come in don't have this type of knowledge. And so This source that I have was from the Harvard Health Letter, and it said, when should you go to the emergency room? And it said that people go to the emergency room due to this lack of medical knowledge, and it gives specifics on different symptoms, on whether or not to go into the emergency room based on these symptoms. So a lot of the symptoms are things that could be non-urgent, but there's also things that you need to be safe with and go ahead and go in. Specifically, it also depends on ages. So a lot of the time, you'll see older people in the emergency room more because they're advised to go into the emergency room on small symptoms. So, for example, if someone's fainted, if a younger person faints, it doesn't really warrant as much. It's not as much of a worry. But with older people, if they're fainting, it could actually, because in younger people, it's more of a drop in blood pressure. But with older people, it's more of a worry. So doctors mostly advise older people, if they have any kind of symptoms, to just go ahead and go into the emergency room to be safe. So a lot of the time we'll see elderly patients that really don't have any symptoms. They just kind of came in just to make sure that everything was good with their health. For things there, this source also gives information on things such as chest pain. So if you come into the emergency room, chest pain is a huge issue. Usually if you're having chest pain, you should go in no matter your age. Of course, it is more of a worry once again with older people, because it could mean a lot of different things, like heart attacks, stuff like that, so that are very serious. If you have a rapid pulse, we see about 120 warrants emergency room. The rest is just kind of is not as emergent, should not be consulted by a doctor. Palpitations is covered. Abdominal pain is described as not as emergent as chest pain, of course, but abdominal pain can mean serious action needs to be taken, but most of the time, a doctor is advised to just let it pass and give it some time before going in. Another issue is bleeding. So a lot of the time, people see bleeding and have a laceration type thing on anything, like their hands, feet, kind of thing. Places that aren't as much for a worry, but they'll come into the emergency room just to make sure, get it checked out. But if there is excessive bleeding from a laceration that's like profuse, will not stop gushing out, that needs to be checked out. Another thing with bleeding is if someone's throwing up blood, they definitely need to be checked out in the emergency room. That's a serious issue. Another problem is headaches. So a lot of people will come in with headaches saying they have very bad migraines, that type of thing. They also like to say that their headaches, like from a 0 to 10 scale, it's like an 8 or something like that, but it's usually just a passing by kind of issue that doesn't warrant emergency room action. So my last source is just when to go into the emergency room, and this can help. This is going to help in the future when I build like a website to inform people on when to go into the emergency room. It's a useful tool for potential emergency room patients because, like I said, I'm going to make probably a website or just to have the potential for a website so people can visit it and just kind of look up their symptoms and see whether or not they should go into the emergency room based on these sources. So my solution, like I just said, is to use sources 1 and 2 to provide information to the public. So like I said, a lot of the problem with people coming into the emergency room for non-urgent issues is that they're not informed on medical issues. They're not informed about their medical state. So sources 1 and 2 will help build a website so that people can just kind of look at symptoms and determine the urgency of their symptoms based on these examples, so that even if you're not educated, you can just go online and you can go and look at that before going into the emergency room, because it really is a long wait to actually get in and get checked out. So it'll be saving the patient's time and the doctors and PAs. And that's the end. Thank you.